Hello, good afternoon, and welcome to today's COVID-19 media briefing. First up, we'll have Mayor Tory. Go ahead, Mayor.
Thank you, Levin, and good afternoon. We continue to have positive discussions with the province of Ontario about whether Toronto can move ahead to Stage 3, and we very much look forward to Wednesday's announcement. Our numbers are continuing to go in the right direction, and you'll hear more from Dr. de Villa on that. That is thanks to the vast majority of Toronto residents who are doing the right thing and following public health advice. We have taken action to help stop the spread of COVID-19 and save lives, such as making masks mandatory in public indoor spaces and on the TTC, and I believe smart policies based on the best public health advice available are helping us now and will help us when we do get to Stage 3. I know many people are eager to open up their businesses, and many residents want to see the Stage 2 restrictions, particularly the playground closures, brought to an end and see those restrictions lifted as soon as possible. I hear you, and I know it has been a tough few months, but I know we all want to move forward as safely as possible because we know, even when we are in Stage 3, COVID-19 will still be a reality. We do not want to go backwards, and we do not want a catastrophic second wave of this virus. The last thing we want is for Toronto to reopen and then, within a very short period of time, perhaps weeks, shut down again. Businesses cannot afford this, the governments, I don't believe, can afford this, and residents don't want this. Today, the mayors and chairs from the 11 largest municipal governments across the Greater Toronto and Hamilton area held their regular weekly meeting to discuss the ongoing transition from Stage 2 to Stage 3. All the mayors and chairs are committed to working with local public health authorities and with the province to make sure that we have the safest restart possible and a strong recovery, which we believe the larger municipalities can lead and will lead. We stand together in urging residents across the GTHA to continue to follow public health advice. Keep your distance from others. Wear a face covering when inside public places or as often as you possibly can, and avoid large gatherings. We're encouraged by the constructive nature of the discussions we continue to have with the Ontario government about strengthening public health requirements in Stage 3, and we encourage them to continue to examine provincial rules related to bars and gyms within this context. We know from public health that private parties and other large informal social gatherings are helping to spread COVID-19 and putting people's lives at risk in the process. Beyond the health concerns, this inconsiderate behavior threatens the GTHA's progress towards an economic recovery and could help to trigger a second wave. We thank the vast majority of our residents who continue to do the right thing and follow public health advice and not convene or attend these kinds of gatherings, among other things. They have worked with us to make sure that we have flattened the curve and saved lives and protected health up to this point. We will not let their sacrifice and patience be in vain due to a small number of people who want to ignore the very real threat of this virus for reasons best known to them. Now, the provincial government also made it clear today that municipalities will receive collectively some $4 billion in federal provincial funding from the Safe Restart Agreement agreed to between the Government of Ontario and the Government of Canada. This is a very positive sign, and we look forward to receiving more details about how this substantial and much-needed funding will be allocated so that we can fully understand how it will help to address our requirements and the shortfall caused by COVID-19. We urge the governments to use up-to-date information in areas such as transit ridership in order to ensure that recent growth is taken into account. We remain committed to working together and to leading a solid, fair recovery across the GTHA, which helps people get back to work and back to a normal, safe, and healthy life. And once again, I want to extend my thanks to Prime Minister Trudeau, to Deputy Prime Minister Chrystia Freeland, to Premier Doug Ford, and to Finance Minister Rod Phillips and Municipal Minister Steve Clark, who I spoke with on the telephone this morning, for all of their efforts in getting us to where we are, knowing that we don't yet have this money in hand, but we know there is a very substantial amount of money coming from those two governments to assist municipalities in the continued delivery of vital services to people and in the continued leadership role that we will take in bringing about a strong and robust and sustainable recovery. Today, I'm pleased to make an announcement that will help to reignite parts of our city that were heavily impacted by the COVID-19 pandemic. And in fact, it goes with an announcement made in the same sector, in the arts and culture sector, just last week. During the height of the pandemic, our beloved arts and culture sector, for the most part, was forced to completely shut down. Over the past few months, I have seen the sector adapt in new ways to provide access to the arts in a variety of different means, including virtual programming and events and physically distanced experiences. COVID-19 has also caused the city to look at all aspects of how we deliver all city services. Today, we are launching Historic TO, a new cultural experience that provides equitable and inclusive access to local history, heritage, and land-based learnings at Toronto History Museums. Through this program, visitors can enjoy a tour at museum sites, green spaces, and gardens at sites across the city. These are museum and historic sites owned by the city itself, and some of them you will know of their names, but others you can look up and please enjoy them. Colborne Lodge, Fort York National Historic Site, Gibson House, Mackenzie House, Market Gallery, Montgomery's Inn, Scarborough Museum, Spadina Museum, and Todmorden Mills. And so from July 29th, this week, to September the 4th, the guided neighborhood walking tour experience will offer visitors an opportunity to engage in discussions and explore Toronto through diverse perspectives. Tours are 60 minutes in length and vary in content at the different museums. The themes include pre-contact history, colonization and the evolution of land use over time, the impact of urban development and industrialization, Indigenous history, Black, LGBTQ+ and women's history, settlement patterns, and immigration. Tickets will be pay what you can with a suggested donation of $10. What is important to note is that those tickets, in order to provide for health requirements and physical distancing, tickets will be required to be purchased in advance and will be timed so as to achieve these health goals, and they're available online at toronto.ca/museums. As part of Historic TO, the city is offering never-before-seen access to the museum's artifact and fine art collections through an online database. The collection consists of 150,000 artifacts, 1.1 million archaeological specimens, and 3,000 works of art, reflecting the 11,000-year span of human occupation of the Toronto area. Making our city's museums and art collections more accessible is in line with our city's goals of becoming a more inclusive and equitable place. It is important that all residents in all corners of the city feel connected to the arts and to these histories and have the opportunity to experience them. Historic TO will help us to get there, but at the same time I would urge Torontonians to visit a gallery, donate even a few dollars to one of your favorite arts and culture organizations, and support artists and the arts and arts events as they are permitted to reemerge, and online for that matter. Though many have had a difficult time throughout the city's population, artists, visual, musical, dance, and others have been very hard hit as shows and performances and venues have been closed. We need to support them because we need their passion, we need their creativity, and we need their work, both for the sake of the economy and their well-being, but also for the sake of the well-being of our city, where the arts are such a vital part of who we are. COVID-19 has prepared us to do things differently. Today's announcement allows for different ways in which residents can safely connect with our city's history and museums, and I can assure you in the coming days we will have more announcements of initiatives that will help artists, who in turn will help us to bring our city back to life. And now, for today's report, I will turn you over to Dr. Eileen de Villa, our Chief Medical Officer of Health.
Thank you, Mayor Tory, and good afternoon. Over the past 2 days in total, there were 58 new COVID-19 infections in Toronto. Today, we are reporting only 5 new infections in our city. This is our lowest number of new infections that we have reported in quite some time. To date, 13,772 people have recovered, an increase of 104 over the weekend. While I'm pleased that our local COVID-19 cases continue to decrease, new infections continue to be reported each day in our city. We know that approximately 25% of these cases are a result of community transmission. I am also concerned by what we are observing in other Canadian cities and locations globally as they reopen. We cannot take this lightly, and we must not let our guard down. I have heard many people speak of COVID fatigue, and I hear that some believe that the pandemic is over. I've also heard that many people may believe that because they have not caught the virus over the past 6 months, they feel confident that they won't get sick. I'm concerned as I continue to hear that some younger people believe that they are not at risk of catching COVID-19 and that they'll not experience severe illness if they do get infected. While it is true that younger people who catch COVID-19 may have a lower risk of more severe outcomes, this does not mean that there is no risk. The reality is that there are people in their 20s and 30s who have become very unwell with COVID-19 infections. There are people in their 20s and 30s who are generally healthy, who have gotten very sick from this virus, and some who have needed ICU admission and ventilator support. Once admitted to the ICU, we know that the road to recovery can be a very long one. The bottom line is that younger people are not immune to COVID-19. We must also consider around us those who may be at risk for a severe outcome. This could be our family members, our neighbors, colleagues, or our friends. This is why I continue to ask you to please think of others and to take care of each other. Finally, we don't want to lose the progress that we have made. There are many jurisdictions that have had to go back, and I don't want to have this happen in our city. I know that this journey has been tough for all of us, myself included. However, the reality is that COVID-19 is still here, and we need everyone to stay focused on stopping its spread. We need to keep physical distancing from others who are not in our COVID social circle to prevent this virus from spreading. So I want to be clear. Having friends over for dinner or coffee who are outside of your social bubble or your social circle of 10 is not physical distancing. Arranging playdates for your kids with others who are outside your social bubble is also not physical distancing. Having a gathering or hosting a house party with people outside your COVID-19 bubble is not physical distancing. Every time you meet others who are outside of your social bubble, and especially if you do not maintain physical distance, you are exposing yourself and potentially others to a new risk. We need to stay focused. We need to stay ahead of the virus so we can keep moving forward. As you know, we have made great strides over the past several weeks to reduce virus spread in our city. This progress is from your hard work in following public health measures. And while it is not possible to predict when a second wave might occur, my team is actively preparing for a potential surge in COVID-19 activity by implementing a variety of public health measures. Further to this, as the Premier stated on Friday, the decision regarding when our city will move to Stage 3 of reopening is delayed until Wednesday. My team and I have taken this extra time to plan based on our unique circumstances and observations from other jurisdictions. This is why, last week, we asked that a number of additional measures and enhancements for the Stage 3 reopening orders be considered for Toronto. My team has also recommended the provision of a safe isolation space for people with COVID-19 or those who are at risk of infection and cannot properly isolate at home. Anyone infected with COVID-19 is required to isolate in order to prevent the transmission of COVID-19 in our community. Unfortunately, not everyone in our community is able to effectively isolate in their current living situation. An isolation site would help people who live in housing that may be crowded or have insufficient space to effectively and safely isolate. An isolation site would reduce the risks of spread of the virus to household contacts, which is known to be one of the most common ways that the virus is spread in the community. This measure was supported by our Board of Health at their meeting earlier this month. And since this time, my team and I have been in active discussions with provincial and federal partners on establishing such a site. All of these recommendations are important investments in our community's economy and our shared future. Above all, I believe that they are necessary to keep our residents safe as we move forward living with COVID-19. The recent increase in reported cases of COVID-19 in other jurisdictions that have reopened before us is a stark reminder of the potential for this virus to spread if it is given the chance to do so. As we continue our journey towards reopening our city, we must be prepared for a surge in virus activity. I know that we all want to get back to life before COVID-19. But we need to keep moving forward with caution and care to protect the health of those around us. We must do this until we have an effective treatment or vaccine against COVID-19. Each of us plays a role. Each of us plays an important role in reducing the risk for others around us. So please, wash your hands, watch your distance from others, wear your mask, and please continue to take care of each other. I'll now hand it back to Lavin.
Thank you, Dr. de Villa and Mayor Tory. We will now take questions. As a reminder, it's one question, one follow-up. Before we get to your questions, we have staff on the line who can answer as well, including Carlton Grant, Executive Director of Municipal Licensing and Standards, Marianne Bedard, General Manager, Shelter Support and Housing, Janie Romoff, General Manager, Parks, Forestry and Recreation, Sue Ching Kukuda, Director, Resident Care and Services at Long-Term Care and Services, Cheryl Blackman, Director of Museum and Heritage Services. First up, we have Miriam Katawazi from CTV. Go ahead, Miriam.
Hello, Mayor Tory. I'm just asking about several images that were shared on social media this past weekend. They were specifically of Hanlan's Point Beach being packed with people, not social distancing on Saturday. What would you say to those people who may be feeling concerned, as well as those who are hosting or taking part in these beach parties and gatherings?
We had quite a discussion this morning about that at our sort of emergency command table, which is attended by the Medical Officer of Health and by a whole bunch of other city officials, including me and the Deputy Mayor and Councillor Cressy. And I think one of the things that we've seen happening, for example, is that while we placed limits for a number of reasons, including regulatory, on the number of people who could buy tickets on the ferry, which obviously is the principal way of getting to the island and to Hanlan's Point Beach, there's also been a huge take-up of water taxi traffic getting people over to the islands and to those beaches. And at the moment, what we want to do is try to really educate people. Again, there were significant numbers of educational encounters between city officials, parks officials, bylaw people, and the public at different places, including Hanlan's Point. And I guess we want to just say to people what we've been saying all the way along, which is that you should avoid crowd scenes, avoid scenes where it's almost impossible to physically distance yourself. COVID fatigue, which we all understand, because I think we all have a bit of it, cannot lead to COVID complacency. It's like when you're given a prescription, and a lot of us don't, I've done it myself, you don't finish the bottle of pills. You think, well, I'm feeling better now, and I can just sort of not take these last 8 pills. And it's really crucial that the prescription we've been given by our medical officer of health, which says avoid crowd scenes, wear face coverings, and try to avoid confined indoor spaces, is followed now more so than ever. So, to me, to close down any of these beaches is an admission of defeat, and it is an admission that we are going to let the behavior of a few who don't consider these rules to be important, or these guidelines or anything else, interfere with the enjoyment of the many who are trying to enjoy the summer as best they can. So we're on top of it. We're going to use the Marine Unit and other resources at our disposal to try to better address some of these crowd scenes on the beaches, but we really, really don't want to close beaches because we have a short summer here. They're a precious resource for us, an asset, and we want people to try to enjoy themselves after a very long winter and spring.
Follow-up?
Okay, thank you. No follow-up.
Okay.
No follow-up.
Thank you. Next up, we have Jasmine Saputis from CBC. Go ahead, Jasmine.
Yes, I have a question for Mayor Tory, and I'm sorry I lost the connection partway through the news conference, so you may have already answered this. And it's about the money that was announced by the province today. I'm wondering, can you give us an idea how much this will affect services? Is it give us some relief? You mentioned the TTC, childcare, things that were on the chopping block in a crisis. What relief will this bring to the city?
The $4 billion announced by the Premier and the ministers today, again, for which I commend them and thank them for all their efforts in getting to that point, that's $4 billion for all municipalities in Ontario, will be divided in two. $2 billion for general municipal purposes and the kinds of shortfalls we experienced or additional expenditures in a number of other areas, and then $2 billion for transit itself. While we don't have the breakdown as yet as to exactly how that will be allocated and how much Toronto will get, I think the total quantum, examined within the context of the size of the population and the size of the transit system we have, indicate that we will get a significant amount of money, and that should go a long way to looking after the problem, the $1.3 billion problem we had identified. But until we have those exact numbers, it's hard to know what the impact will be, other than to say it's going to be very positive.
And I have another question I just wanted to ask. It's COVID related. It's about the recommendation by the medical officer of health that the city council is going to look at tomorrow to build a site for COVID isolation. A hotel is how it's been described in some cities like Chicago. I understand you're in support of this recommendation by the medical officer of health. And you just mentioned today we are going into stage 3. In your view, why do you support this recommendation to start negotiating with the federal government for this specific space for isolation for people who do contract COVID and live in tight quarters?
Well, first of all, I'd like to say, maybe in an optimistic tone, that we are well along in discussions with the federal government. We've been talking to them about this at their early initiation back some time ago as to whether we would think such a thing would be helpful to us. And I would say that subsequent to that, we've had a lot of evidence that has come out thanks to the hard work of our own public health people in examining who is getting COVID-19 in the city, and we of course have seen lots of evidence to suggest it tends to be people from lower income groups and who have housing that is more concentrated in terms of large numbers of people, often living in a relatively small space. And so having had those facts in front of us, it led us to the conclusion that this would be very, very helpful to at least allow people on a voluntary basis to have another place to go to isolate, as people are supposed to do if they test positive, rather than going back to, say, a crowded apartment where there's very little opportunity to self-isolate and where there's a higher chance that you're going to infect somebody else. So I'm very supportive of this. I have been speaking to officials in the Government of Canada, as have our health officials, and I'm optimistic that we will get permission to have this happen on a funded basis before too long.
Okay, thank you. Next up, we have Ashley Legasic from News Talk 1010. Go ahead, Ashley.
Hi there. The Premier and the Minister responsible for municipalities said the funding announced today should start rolling out in the coming weeks, but we've heard repeatedly from you and other mayors that The funding is needed now. If the province doesn't make it clear in a reasonable amount of time how the money will be divided among municipalities, will it be too late? Will those cuts have to be made and those taxes raised anyways?
I have seen the assurances that came from the money coming itself from the two governments, and again, I thank them for the fact that they came to an agreement, and it is a significant sum of money that will be coming to Ontario municipalities, including Toronto and those in the GTA. We also are able to deal with the cash flow challenges, in other words, the timing of this, and as long as it doesn't get dragged out, and I received assurances from the Minister, Steve Clark, today, that that will not be the case, that they're going to start to flow some of this money soon. And so again, I'm very positive in my outlook about the fact that we, subsequent to discussion we'll have at City Council in the next couple of days, can go a long way to addressing some of the financial challenges set out in a very excellent report written by our Chief Financial Officer and our City Manager. And I think the province understands the timing requirements and will be responding to those in a manner that is careful, but at the same time recognizing the urgency and the size of the problem for many cities and towns across Ontario and across Canada, but it's their problem to deal with Ontario.
Thank you. And my next question is about some of these large social gatherings we're seeing throughout the pandemic. The city, including its bylaw department, has been giving people the benefit of the doubt and leaning on an educational approach. But we're only seeing more of these social gatherings happening, especially after moving into stage 2. And people know they won't face any strong penalization for breaking the rules. Is it time to change the tone and start handing out some hefty fines? If not, how will our city be able to move into stage 3? And perhaps Dr. de Villa could comment on that last point as well.
So on the point of enforcement, first of all, I have to emphasize yet again that I don't direct enforcement activities, whether they're light or heavy. And I will also tell you that we get lots of feedback from people who think we're doing too much enforcement or enforcement officers are too present in different public places and so on. I tend to think with these large backyard social gatherings, that I hope that our enforcement people will be stricter, because that is a totally self-initiated activity where you invite the people and then you let them gather in your own yard, and it is obviously contrary to the rules. And so I hope they will take a stricter approach on that. We saw in Brampton, on the one that was highlighted over the course of the weekend, that the person has been charged, and I think that's very appropriate. This is irresponsible behavior. It is inconsiderate behavior when it comes to the health of other people. It is in direct violation of all the rules and guidelines that have been set out, and it is going to set the entire community and province back in terms of our ability to get back to a normal life. So to me, that is worthy of law enforcement, and but I don't direct that. I would just express the hope that our enforcement people on that aspect of this, the private parties in private yards, will take a stricter approach, because I think those people have to be told that this behavior is just not going to help us to get out of this nightmare.
And if I can add further to the question, when we think about moving towards stage 3, I'll remind everybody that, of course, we have our monitoring dashboard, and that is being updated today. And our progress is being documented there, and it actually is, we are progressing very nicely. My understanding is that with our latest figures, we should be on, we have 4 different categories of indicators, and we will be green on 3 out of 4 of those categories, premised on the numbers that we have as of late. So I think things are moving in the right direction. We do need the continued collaboration and partnership of members of our community, sticking to public health measures as much as possible. We recognize that there are a few in our community that perhaps are not heeding the advice and heeding public health measures as much as we would like, but we are counting on all of us to continue our focus so that we can keep our progress moving forward, so that we can see the numbers go in the right direction in our dashboard and move safely as possible into stage 3 and beyond.
Thanks, Ashley. Next up, we have Jennifer Pagliaro from The Star. Go ahead, Jennifer.
Hi there. I wanted to start with Dr. de Villa. Obviously, the number of new cases for Toronto seems like an encouraging update, but we know we're seeing rises in other parts of the province, and I just wonder how confident you are in moving to stage 3, perhaps by the end of this week, depending on what we hear from the province later this week.
Well, certainly very hopeful about moving towards stage 3. We have seen great progress, as I just said, on our monitoring dashboard, and we're putting a number of measures in place, planning for future activity, learning the lessons that we have had the ability to benefit from ourselves, and as well learning the lessons from other jurisdictions. That's why we've put recommendations forward on what can be done to enhance and improve on the existing Stage 3 reopening orders that take into account our unique circumstances here in Toronto. As the largest city, densely populated jurisdiction, we know that there are unique circumstances we have, but we also know that we have incredible capacity. We've seen the people of Toronto really move forward, stick to public health measures in large part, and I think that's what will see us through to Stage 3 and through to beyond Stage 3.
And can I just ask both of you, I saw in the letter from the regional mayors and chairs that there has been ongoing, positive, it sounds like, conversations about the recommendations from the city. I just wonder if we could get more information about whether we're expecting that as part of a Stage 3 reopening for Toronto specifically. And if not, do either of you think that we should move ahead?
Well, can I start by saying that we don't know at this stage of the game whether these will be made requirements for Toronto only or for the GTA or for the entire province, but I am optimistic that some of these will be incorporated into some of the rules and other mechanisms put in place by the Government of Ontario, because I think they recognize that these are sensible things that will help us to have a better and more successful Stage 3. I can also tell you that we have prepared materials within the bounds of the jurisdiction we have, such that if they decide not to move ahead with some or all of them, we can do what the city can do, which is not unlimited, but we can do some of these things to try and, again, produce the same healthy, safe Phase 3 or Stage 3 for the City of Toronto and for its residents and for its businesses. So we've got sort of different game plans put together depending on what we hear from the province over the next couple of days.
And Jennifer, if I can just add, I share the mayor's optimism on this. And I would further say that, over and above what the city can do or might be able to do to enhance safety in the city, obviously, as medical officer of health, I have an obligation, and with my team, we're constantly monitoring that which is happening. And if there are specific circumstances where, my authorities or powers need to be brought to bear in order to enhance safety, health and safety here in our city, then of course that's always an option as well. But we remain optimistic and, really are counting on the people of Toronto to continue to adhere to public health measures and good practice.
Thanks, Jennifer. Next up, we have Catherine Aylesworth from Global. Go ahead, Catherine.
Hi, this question is for Mayor Tory. So a recent Ipsos polling for Global News suggests that 51% of Canadians are in favor of defunding the police and reallocating resources elsewhere. So Toronto recently rejected the 10% cut to police budget, but are there any plans to reevaluate the decision, as this is still something that is clearly the public is interested in?
Well, we should be very clear that the decision taken by Toronto City Council by an overwhelming margin was that we would go about identifying different ways in which we could deliver services presently provided by the police, including, for example, mental health, which has been well discussed, and that the expectation is that as those models for delivering services differently are developed and implemented properly and sensibly and so that the client group in question is well looked after, we would expect to see adjustments to the police budget. And I think what you really saw in the decision overwhelmingly accepted to look at the positive by the City Council was a decision that said you develop the reforms and the new models of delivering services first. As you detask the police with those kinds of things they no longer will do, you will then be able to make adjustments to their budget accordingly. And so it's just a different way of going about it. It's a way I happen to support, as did the vast majority of members of the City Council. So I think we'll end up in a place that people are going to be satisfied with, and that we'll have seen significant reforms, significant assignment of responsibility to people like mental health professionals who can better look after those calls, and you will see with that a reduction in the police budget, and I think that will cause everybody to be where they think we should be. But it's just a different way of going about it, and I'm satisfied that the majority of council picked the right way to go about this in terms of just having it done in an orderly fashion that doesn't leave people casting about while we're in the process.
Okay, no further questions. Thank you so much.
Okay, thank you, Catherine. Next up, we have Christina Tenalia from CB24. Go ahead, Christina.
A few questions about this already, about the money from the province. What I'm wondering, though, is can you be clear on if you were expecting to get the entire $1.3 billion to meet the city's needs? And if not, what's the plan to fill the void?
I'm hopeful that we can get the entire $1.3 billion, but I can't say I'm expecting it in the sense that I know that out of a total of $4 billion, they will have to allocate this as between transit and other municipal uses. I'm aware of the fact there are 440 cities and towns, albeit that we're the biggest in Ontario, and we have by far the biggest transit system. So I'm optimistic that a big part of our problem will be resolved with these funds. And again, I thank the two governments for the fact they've put this amount of money forward in the province of Ontario. So we'll keep working to make sure our interests are well represented. I think I've been pretty vigorous in asserting our interests so far. I will continue to be, but in a constructive way. And it just proves, again, when you work together, I think you can get what it is you need to keep moving forward, and that's exactly what we'll do in the coming days. But I'm optimistic that we won't have to have any game plan of any substance to inflict negative consequences on the people who need help the most because we will get this kind of support, but we'll have to see.
Okay, and I'm wondering if someone in municipal licensing and standards perhaps can give us a bit of an update about this past weekend. We know that by law enforcement officers and the AGCO have been visiting patios in the city, have looked at restaurants to ensure people are dining indoors. Wondering if we can have an update on the weekend numbers, and depending on what the numbers are that you share with us, do you think that these numbers could have an impact on Toronto's likelihood on moving towards stage 3 to be announced on Wednesday?
Carlton, go ahead.
Hi, it's Carlton here. Thank you for the question. This weekend, Toronto Public Health, MLS, police, and AGCO were out to 33 different establishments. We noted that 8 were non-compliant, 7 of which received warning letters, and 1 received a charge. Many of those that had received letters in the past couple of weekends were compliant, and so we're pleased with that people are taking this seriously. It's important that the people that attend these places take these seriously as well. We will continue to be out there, we will continue to educate, and we will continue to do warnings and charges as they're warranted.
Okay, thank you, Carlton. Oh, so lastly, we have Meetu Madahar from CTV. Go ahead, Meetu.
Oh, hi there. Mayor Tory, this question is a follow-up to an earlier question about social gatherings and beaches, specifically with the 2 parties that were recently held at Cherry Beach. You know, the parking lot at Cherry Beach closes at 7 p.m. on weekends. Why are these parties not being shut down? Why are they still being allowed to continue? And we also understand from one of the DJs at both parties that there were police officers on site, but no tickets were issued. So why are they still being allowed to continue?
Well, I think we found a fair degree of success by closing the parking lots, by limiting access to the parking lots at an earlier time of the day, that this encourages people to leave and not to arrive for sometimes that sort of later evening type of party. But I can assure you we assess this every day. We talk about the campfires, which are illegal. We talk about the consumption of alcohol, which is illegal and sometimes excessive. We talk about the crowding on the beach itself, and as I indicated, we've talked as recently as this morning about using other assets, including the Marine Unit and other things, to help us in the job of making sure that, you know, we try to educate people as best as possible, as opposed to handing out all kinds of tickets. You know, I've been through this long enough now. You know, I've sat up here and had to announce the closure of playgrounds and the closure of bars and so on. I don't want to announce the closure of beaches or a heavy hand. But as we watch the situation, and we've seen, I think, fairly good cooperation over the last few weeks when it's been hot weather, if we find that we are not getting the kind of cooperation from this educational approach, then more tickets, I'm sure, will be issued by the enforcement authorities. I don't control that, and we will take other steps as needed to make sure these kinds of crowd scenes are not repeated over and over again.
Okay, and Dr. de Villa, perhaps you can answer this. You know, with Toronto under stage 2 currently, with only groups of 10 people being allowed to get together, how big a risk do these types of beach parties pose?
So with respect to large gatherings, right, there is certainly a risk. We know that the issue with COVID-19 is that it spreads, its primary method of spread is from person to person. And we know that people may actually have COVID-19 infection and not have symptoms, or they can spread the infection at a point when they don't actually yet have symptoms. They may subsequently develop symptoms. So there's certainly risk anytime there's congregating, although that risk is clearly higher when it's in an indoor space. So certainly outdoor spaces are safer, but we cannot say that they're completely safe. That's why we continue to remind people that it is important to watch your distance, especially when we're talking about people who are outside of that social bubble, your social circle or bubble of 10. And to wear a mask in those circumstances when you're not able to maintain that social distance. Of course, wash your hands, and if you clearly are sick or have some kind of symptom, we're recommending that that's not the time to go out. Stay home, keep your illness to yourself, get yourself tested, certainly, if you have symptoms, but it's just the best thing that we can do to take care of each other and to help our city move forward to stage 3, and as I said, hopefully beyond that.
That's it for today. Thank you, everybody. Our next media briefing will be Wednesday, July 29th at 2 p.m. Have a great week.